Summer setup. Sometimes it goes to my phone, so I make sure that's not the case. Okay. Annie, I'm so excited to have you here and talk about many things, wellness, mental health, trauma, therapy. First, I want to give you a chance to introduce yourself, to our audience. And just so you know, with context with Beyond the Mind, I know we've chatted about before, but our mission is really to make sure everybody gets a chance to feel seen and understood and understand themselves so that they can reach their potential. So anything within your journey that calls to that, would love to hear as well.
Oh, okay, great. Well, thank you so much for inviting me. And I know we connected earlier. We had so much to talk about, so I'm really excited to talk more. And for those who don't know, I am a BCBA, and that stands for Board Certified Behavior Analyst. And really what my training is and what I do is I kind of study from a scientific perspective of why people do what they do, right? So we collect data, we analyze, we come to hypotheses of why we might behave a certain way, why that person might respond a certain way, and we use, scientific concepts and data to really determine what's going to help you move forward or what's going to change something in a more positive direction in your life. So that really could be any challenge in your life. But that's really something I'm really passionate about. And I feel like often our field is associated with autism when really it's just purely the behavior of science, right? I really want more people to know that. And I am also a trauma breath coach. So I know we're going to talk about that a bit more, but that just means that I can facilitate breath work and really facilitate any trauma responses that come up from that too. So if there are certain signs that I'm seeing, I'm trained to really understand from a trauma-informed approach to know how to respond, how to support you, and how that might come up.
Wow, these are both such fascinating fields. And we're both in the Bay Area, Silicon Valley, high tech. And so it's fascinating to me because when you say data and behavior, I think about, the data and behavior that the algorithms use for like Facebook or Instagram to get people, watching more reels and understanding behavior almost to drive usage, which is a lot of, like I worked on, we call clickstream data, which was actually like learning where people click and how to capture that data to help move them through the desired flow and experience. So it makes sense that you would use data to like understand behavior and then steer it towards the behavior you want, but you're working on it as like then with an individual human. So I'm curious if you could talk more about like, what is the data that you use to understand any given person's behavior?
Yeah, well, there's various forms and various ways to collect data on a person's behavior, right? It's what we call either indirect or direct data. So there's indirect, meaning we collect almost like survey questions and we ask questions to collect information that way, like questionnaires, or we could do direct, which is really directly observing. Like I might be collecting data on how you're responding to me right now. I'm writing, what did I say and what did you say in response? And what was the result of that, right? So it's what we call ABC data. We collect the antecedent, or you could call that the trigger or whatever happened right before, the behavior itself that we're collecting on, and then how the response happened after. And what that does is it gives us behavioral patterns of how that person's acting and what might be pushing them to maybe respond in a way. Maybe they're like, I can't stop saying this phrase. And I might collect like, okay, well, I wonder what's prompting it. And I wonder what might be maintaining it. So we look at a lot of those behavioral patterns to help you discover, okay, how can we shift this then if this is something you want to change?
Okay. So you're collecting data on the individual person. And then do you use data ever on like large samples of people? Because are there just common behavioral patterns that are really, I imagine, really limiting for a lot of us, like eating junk food when we want to get healthier? And does that feed into your work or is that separate?
That's a little different. So applied behavior analysis focuses on a single subject, which just means we're very individualistic when it comes to providing you guys tools, right? So what works for one person is not going to work for another. And your history, your context, your upbringing, so many things that feed into that data help us understand how to individualize those tools for you. And so it's never going to be the same. And I would hope that it's not, right? Because I don't want to give you something and I'm like, yeah, this is going to work for everyone. And then you're like, wait, this didn't work, right? And it's because it has to be individualized to you and your experiences.
Wow, that's fascinating. Yeah, I mean, I can totally see the value of that individual assessment. And then, like, just tell me more. Like, do you work with individuals to like then help them understand how that certain pattern is limiting, or do individuals? I guess, yeah, maybe if we start from the beginning, do individuals usually come in knowing what they want to achieve or how their behavior is limiting them?
That's a
You
great
mentioned,
question.
yeah, you mentioned autism as like a
Yeah.
association, so maybe there's a historical context there, and I'm super curious what that might be.
Yeah, I mean, I did work in the autism field, obviously, for at least 10 years, I believe. And so I obviously do have a lot of experience working with neurodivergent individuals. And I think that gives me the upper hand in the sense of like, I really have a deep understanding that we operate, especially cognitively, so differently, right? How we process information, how we learn, it needs to be inclusive, right? Especially with neurodivergent individuals, this is so important. And so I think, yes, it's helped because I think like understanding, what was your question again?
Well,
I don't want to go off topic.
I actually jumbled a bunch of questions together. I think the question I should have asked first was, what is the association with autism for your work? And yeah, and then I'll come back to the second question.
Okay. Well, the first question, honestly, the main reason we're associated with it is historically from some of the early learners and people who created and really made applied behavior analysis, which is my field, that's what we call it, ABA, what made ABA popular. And it went into insurance, where insurance said, okay, this works for children with disabilities, specifically with autistic individuals. So you're going to work with them. So within insurance, we as BCBAs can only bill within autism, maybe sometimes ADHD and other neurodivergent disorders or diagnoses, but it's really within that bubble. And so often you only really hear that in order for us to get work, we can only really work in a clinic where we can bill for that.
Oh, that makes sense. And that seems so limiting because as you were talking, I was thinking about like a behavior that could come up with somebody who's having ruminating thoughts, and then they start developing this pattern of behavior that then becomes like OCD, right? And so I can see that just right there, there's a huge value that if there's even a question of, can I get insurance to cover it now, can become a barrier.
Yeah, and I think in our field in particular with ABA, it's a big struggle. There's a lot of BCBAs who struggle finding work, who feel burnt out because of the insurance and the requirements. And a lot of people unfortunately leave thinking and believing that unless I work in the clinic and autism field, I have no other work. And that is honestly what inspired me to start my company. And I wanted something different from that.
Oh gosh, I want to hear more about that shift to starting your own company, but first I want to go back to that the other question, which is when people come to you, like, well, since ABA isn't like, I guess, as known of a field, how do people come to you? How do they find you? And then do they know what targeted behavior they might be wanting to work on, or is that something that is part of like the early assessment process?
Yeah. That was your original question. Now I remember. I think a lot of times, so I have a variety of people who come. Sometimes they're parents, they're neurodivergent parents. Maybe it's to support their child. It could just be regular adults who struggle with anxiety, trauma, and variety of just chronic symptoms. Now, I would say a lot of times people come to me for very specific goals, like, hey, I have this problem, I want this. And I love that. But often what we do is once we do the assessment and once I start coaching and teaching them and helping them build up their self-awareness, they start realizing, oh, I have to work on this and this and this to get to this, right? So it's like an equation. And they start realizing, one, it's not going to be a one and done, right? It's not going to be, 10 sessions in, I'm good to go. And so usually they end up staying with me. Or two, they realize, oh, actually, I think I need to work on my anger more or my emotions more. I once had a client who came in and she originally thought that she had such good emotional self-awareness because she has deep empathy, she's neurodivergent, she really feels. And towards the end of our coaching package, she was like, you made me realize I have a lot to work on with my emotions, that I'm not emotionally in tune at all with myself. And I think that's really not my goal, but it's like I hope to expand their understanding and awareness, that they're like, oh, there's this whole entire world that I can
Yes.
access.
That was my experience when I started therapy in a modality that was a trauma-informed modality, because in other talk therapies, kind of talk about how I felt about a situation, like I was really angry or this happened, and I would tell the story of what happened. And I think the first time I saw a therapist who was just, trauma-informed and knew the importance of, I think, connecting to the body. I remember when she just asked something like, where do you feel it? Or, tell me more about the emotion. And I just drew a blank. I was like, it's anger, like, what do you mean? I'm telling you, I'm angry, and I felt the same. I thought I was really emotionally like in tune because I wore my heart on my sleeve, but it took a lot to realize, like, actually it's completely dissociated from my body, and recognizing the emotions, and even learning, like, wow, there can be a whole journey to hearing the way your body is feeling emotions. Like, that was mind blowing for me,
Yeah, I agree. I've experienced the same too, so I understand.
Yeah. Oh my gosh. So then tell me how this work led into wanting to learn more about trauma and breath work.
Oh yeah, that's another great question. I think for me, it's both personal and professional, right? So I think in applied behavior analysis, unfortunately, we're not actually trained in emotions or trauma or any of that. That is something I sought out myself because I felt that the traditional way of studying applied behavior analysis was very boxed in. We address what we see on the outside, but rarely we're not taught how to address what's inside, like what is going on in our body, like you're mentioning. So due to my own personal experiences, figuring out, especially during the pandemic, like, oh, I have really, really severe anxiety, and just lots of signs from complex PTSD, and going through a variety forms of abuse growing up, and just navigating all that through my 7+ years of therapy. And along with my clinical work, I'm like, why I really need to integrate this. Like, how could I not, to offer a better quality service to the people
Yeah.
right?
Can we click down on that a little? Like, what were you noticing during the pandemic that was telling you, like, this is anxiety, not just, because I think a lot of people think I'm anxious because my life is, got things that are inducing anxiety. But then there comes a moment when you're like, no, I have anxiety. No matter what situation I go into, this is going to be there. So I guess, yeah, what was the aha moment that was surfacing for you during that time?
I think honestly, there wasn't one singular aha moment. It was like a buildup, right? It's like a volcano buildup.
Yeah.
And often I think it happens to many of us where we're like, if we hit something, it's so bad, it's so dark, it's so deep that we kind of have to face ourselves. And
Yeah.
I think that was a lot of things. Even studying for my board exam as a behavior analyst, I failed the first time. I actually put it off for, I don't know, 3 to 5 years.
Yeah.
It took me a while, and I didn't realize that that was a lot of my anxiety and perfectionism. I didn't realize that was a big barrier. I was just like, I'm not studying hard enough. I'm not doing this. And you realize at some point you've tried every single possible modality and nothing's working,
Yeah.
right? And that's when you realize, okay, what is going on? You're forced to, and this is where I got into more holistic health, right? You're forced to push past those other barriers and open yourself up to other things that maybe you weren't open to before. I wasn't always holistic, right? I wasn't always into that, but I think there's so much value in understanding that there are so many different modalities out there that can help you, and they're
Yeah.
not all going to help you specifically. You do have to figure out what works, and that could be even breath work, right? Like I could offer breath work for somebody and it doesn't work. So
Yeah.
that's where individualizing and figuring out what works for me. But that was a long journey.
Yeah, and I feel like you just called out something that's so important, that a lot of people can relate to is you're trying so many different things, right? And it's almost like, to me, it sounded like almost like you got to like this process of elimination. Like, wait a minute, if I'm trying all of these different things and it's not working, like there must be a blind spot here that's like just deep within that I need help to get to, right? Is that kind of you got to? Yeah. And that's I don't know, that's such a hard place to get to. I know I'm in one myself where I'm like, there's a deep issue here because it doesn't make rational sense why I cannot take these steps. And going to like the fact that there's so many different modalities out there and you don't know what that blind spot is, like, I don't know, what are your thoughts of like, or how to navigate it? I mean, I imagine through your work, you had a sense that it could have been, I guess, did you have a sense that it could have been like trauma related or a deeper issue? Or I don't know, how do you go about like now exploring this blind spot that you're like, I have no idea what I'm dealing with here?
Yeah, that's a weighted question, but I will say it starts with being able to be honest with yourself.
Yeah.
Right? Because if I'm always like, I don't have this, I'm fine, I'm good, like I don't need to blink, right? Like, how, if I'm not honest with accepting my terms and my situation and being able to almost be humble, even be like, okay, I really need help.
Yeah.
And I don't know what to do, right? I think it really starts from a place of this humbleness of like recognizing I don't know it all. And I really need that community to support me, even if I don't want it, even if I'm not used to it, even if I don't know how to ask for help. I think that's one aspect of it. And the second part is recognizing what is the core fear and script you are continually telling yourself up from your childhood. And for me, that was, you will never, ever be enough.
Yeah.
And that impacts my memories, my experiences, how I perceive things, how I perceive how people treat me and talk to me.
Yeah.
It influences my decisions. And so for me, the biggest thing, and this is ongoing, is practicing self-compassion for myself.
Yeah. How were you introduced to sorry, it's a red light. Okay, well, hopefully caught it, but you could hear me, so I'm sure it's fine. Yeah, I guess, how were you introduced to the practice of self-compassion? Well, I guess I want to ask first, because I know you've talked about your upbringing and you're Asian, I'm Asian, so I'm making some assumptions here about like maybe similar upbringings about, education and maybe less importance on taking the time in your day-to-day for how you feel. So just tell me more about your upbringing, because these are just the assumptions that I'm going off of,
Yeah, I'm sure we have overlap. Whew. My upbringing, I would say, is pretty traditional in the sense of growing up as a Chinese American, and I am a daughter of an immigrant. So obviously, my mom immigrated here. I have a quite rocky childhood where my father left us when I was still a young toddler or baby, and I think that put a lot on my mom. She did get remarried, but it didn't go well for me. but I would say her health was not great. She got sick when I was very young. And I think this influence of just the pills that she had to take, having to get a lung transplant, the pills that you're stuck with and dependent on,
Yeah.
cause things like depression and other health issues. That then contributes to how she raised me, how she talked to me. I truly believe she didn't mean to necessarily always treat me this way, but unfortunately, this was the circumstance where I heard a lot of things that I really shouldn't have when I was a child, right? And there is also this sense of, and to me, I think this is where intergenerational trauma comes in and behavioral patterns passed down come in. But this sense of you are not good enough through criticism, through shame, through like I could say or do something wonderful and it's just never good enough. There's always a comment she has to say that shows that it's not good enough. And I truly believe that's where my not good enough script is. It's so ingrained in me, especially as a child, right? That's where that stems from.
And did you grow up with, I guess, like a big Chinese community around you? Like, did you see that in others around you? I guess a little, and I'll like my question behind the question is, like I know in my experience, there are some things that I was like, oh, this is cultural, and maybe generalized a lot of things as being cultural, So I guess there obviously were some unique circumstances in your home. So I guess how did you like kind of make sense of that when you were younger, of what was perhaps unique to like your specific situation, or that was like, oh, this is, how families behave in my culture?
Oh yeah. I mean, I don't think I dived into that, excuse me, until my 20s, right? Because when I was a child, to be honest, I think I disassociated. So one, I don't remember anything. The trauma was that bad. And two, I think there's this hierarchy. I think this is common in Asian cultures where it's just like you just listen and do what your mom tells you. And so there's a sense of obedience where I didn't know how to speak up. I didn't have a voice. I mean, that was not a thing. Like it was normal for me to not speak up, to not question, to not have a voice. I listen, and that is how I get reinforced. That is how I know I am loved, accepted, and valuable to my family and mom.
Yeah. That's hard. I mean, having a parent with an illness, all the like, I think that's the thing that when people talk about their journeys is it's never like one isolated thing, right? And I think when people talk about PTSD, you could be like, this is it. But you could see with your story, there's layers in there, right? There's just so many layers that for a young child is, I mean, you said in your, 20s, you started thinking about it, and I know for me, it's like those questions came much later, and because it's hard, it's really complex, and takes a lot to unwind.
And
I asked the question about the cultural aspect because I was chatting with my daughter the other week. We were watching a show and there was something on it that just kind of sparked a conversation about abuse. And it was really interesting to me because I realized like for her, she has like one definition, based off of what she's seen on TV, school, how she's been educated about abuse. And I was telling her, like, I always had two different definitions. Like, this is abuse in this culture, but it's normal in this culture. Okay, so I can't call it abuse.
Yeah.
And I was giving her an example of, I remember when I'd gone to India to visit family and went with my cousin to pick up another cousin from school. And I mean, I couldn't read the sign. We went in and we were standing outside the door. The teacher had gone somewhere. And all of a sudden I felt this like sharp slap on my back. And I just remember being so shocked, growing up here in American schools. I turned around, the teacher had slapped me and my cousin on the back. And Like I went home and I was like so upset. I was like, she can't do that. That's abuse, and all the family around me were totally laughing. They're like, no, this is India. That's nothing, and I remember that was just one of my first lesson of like, what are you talking about? Like, how is that allowed here and just normal,
Yeah. Yeah. I 100%. I mean, I feel like we could spend hours talking, but it's a lot to discern and suss out. Like I'm still trying to figure out those those minute differences sometimes.
Yeah. And like to your point though, of like the behavioral analyst work and understanding someone's individual behavior, I bet you have a lot of people then are coming in that are like maybe taking a behavior that they think is normal, but it's actually unhealthy for them, right?
Oh yes, all the time.
Yeah. What's that like? Because I know for me, it took a lot for me to wrap my head around things that I was like, oh, yeah, this is normal, but it also was really unhealthy for me, Maybe even if it was okay for others, like for me, it had this effect. Like, so how do you help somebody grasp that,
Yeah.
Yeah.
Well, we know that is a very long process, but I think, from a behavior analyst perspective, there's many components we have to keep in mind. So we have this term called motivating operation, which just means that what motivates you is different than what motivates me. So understanding what is driving that person, understanding their values, understanding their history of punishment and what maybe doesn't drive them, what makes them want to run away from something, right? That's how we collect some of that data. But also, I think a lot of it is increasing that level of self-awareness. So we really want to get started understanding these different components, like what motivates them, what's their history, and then figuring out what does motivate them, what are their values, and then asking like, well, what are your values? Do you even know that, right? Like sometimes people don't even know that. So it starts with asking very simple questions sometimes so that they themselves come to that self-awareness. It's not our job to make that happen, right?
Yeah, that makes sense. So it sounds to me like they have this aha moment of like, I don't really know my own values, but
yeah,
they probably have a sense of like, I'm saying the values that I think I'm supposed to say,
Yeah. And that's again, like, so from a trauma informed approach, that's where maybe I ask like, hey, would you be okay with me running a values assessment? Or would you be okay with me, us doing this exercise to help you understand it better? And they can say no, right? It's my job to gauge their comfort level and their capacity level to understand, is this something they're even ready for?
Okay, so you totally now dived into something awesome that I know we kind of touched on a little bit in our last conversation. You said from a trauma-informed lens, you asked them, is it okay if I do this?
Yes.
Can you talk, I mean, like, I love this. Can you just break down what you said there? Why is that so important? Especially, why does understanding trauma, like, I'm trying to get to my question. It's your knowledge of trauma that forms how you ask that questions and the importance, I'm assuming, of giving that person agency of kind of their experience. So can you break down how you learn that and why that's so important? And I'm kind of also trying to understand, like, if that person has trauma in their background and they're sitting in front of someone who's not trauma informed, and then that person does the opposite, what could happen? That they might be aware of.
Okay, bring up that second part of the question because that's a heavy one, but I'll answer the first one.
Okay.
So I think like when you understand the full experience of a person, right? You understand how their nervous system operates, the neurobiology of it, how your experiences influence your neurobiology, right? That includes your organs, your parasympathetic nervous system, like so many things. Then it's not just about how they're acting, right? In a behavior analysis, we're looking at how they're acting, but it's also how are they internalizing it? What is going on in their brain? What's going on in their body? How can we read those cues? And I think that's really important because it's like, can you give me an example of something you don't like maybe a hobby or activity?
That I don't like.
Yeah.
I'm not a gardener. Like I can't keep a plant alive.
Okay. If I'm like, okay, you need to take care of these 20 flowers, pots of flowers.
Yeah.
And I expect them to bloom by next week.
Right.
I'm like, does that sound reasonable to you? Would you want to do it?
Yeah. Yeah. Right.
And so it's the same as like, I don't throw a child in if they don't know how to swim either, right? It's the same concept that like, if your nervous system or your brain, whatever part is not ready, it doesn't make sense to expect something and request something or tell you something that you're not ready for. And to kind of answer that second question, what are the repercussions? Well, we create more history of punishment for you that becomes more aversive. So let's say this person has a bad experience with me because I was like, oh, why don't you try this or do this when they're not ready?
Yeah, I want to click down on it more because I think when people think about this type of work, like I'm just gonna say, like if they think of like just therapy, right? The standard is like a talk therapy, just a very dialogue-based conversation. And at least from my experience and a lot of the interviews that I've done, I think when people have taken like just, okay, I'm going to go find just somebody who works with my insurance and go to them, there's not this understanding of like, is your nervous system ready? Like to me, it seems like there's these huge branches of work done that are just assuming that everybody's nervous system, that you show up at a certain age, you've lived certain life experiences. So there's like an assumption that your nervous system is ready, So I don't know, can you talk a little bit more about like, what do you mean when you say your nervous system is ready?
Yeah. So, I mean, I think you bring up a good point. First of all, is like, it's not even age or whatever it is. If we think about just neurodivergent individuals, and especially we're talking about what they've gone through, the history, intergenerational trauma that's been passed on, like it doesn't matter. Like we all have different capacity levels. That's the point.
Yeah.
Right. And if we were to assume that, that's doing more harm than good. And I think like just understanding like the cues of when a person is ready and when they're not, that is part of being trauma informed is can you pick up on those cues?
Yeah.
Non-verbally and verbally. So maybe it's, you notice this person tensing, right? Okay, well, that's telling me something is uncomfortable to that. Maybe that tells me I need to take a step back, right? So being able to read, and again, those cues are going to look different for each person. But as a facilitator, that is part of my job is like, can I pick up on those cues? And that it requires me to be in tune with myself.
Yeah.
And that's something I think it can be challenging for practitioners.
Oh my gosh, isn't that so true? Oh, wow. And was it in your trauma-informed training where you really started to understand more about, I guess, the importance of thinking of the nervous system as this base, to like thinking about how ready is this person and focusing on their the reactivity, right, to the questions you were asking, or had you learned it before starting your trauma work?
I learned this when I was getting certified in my trauma breath coach certificate.
Okay.
We learned how to facilitate this, obviously within a breath work course or workshop, whatever we're facilitating. So being able to pick up on cues, like if someone is showing those signs of panic or anything, like how do we respond and support them? And I kind of honestly just generalize that to any client session or any situation, because you can, right? Doesn't need to be just within some breathwork session. You can pick up on this in other settings as well. And I think that's really important, that like when we learn a skill like that, we're not just applying it to this singular aspect. It needs to be able to be broadened in all aspects.
Yeah.
What's going on in your mind?
I don't know if I'm stuck with a question or like I just know from my experience, like it took a lot to understand the importance of even working with my own nervous system, and I know even doing the work, I do yoga, I've got certifications in yoga, I've studied trauma within yoga, and then have done my own trauma work within therapy. But the biggest shift for me was when my daughter was ill last year, because there was so much of her needs that really had to focus on calming her nervous system and helping her nervous system remain calm so that she could feel safe in her body, because she'd had this volatile health journey. And then I think any individual who's gone through that, it takes a long time for your body to settle and just feel like, oh, I'm okay, let alone like a 15-year-old who is like first getting exposed to the medical system and how disorienting it, like that causes all this extra stress, right? So there was like a lot of focused work. And I didn't realize it until we came out of the most difficult chapter there, how much I had shifted my own thought process of really paying attention to my nervous system. And it feels funny now because, in the past, it's like it could have had something that was like triggering me and I just pushed through it, right? But now it's like it become very important to be like, oh, there's something there, and even if I know that, okay, but I can look around, everything is safe, and I need to work with it. Like if I can, I will now take the time to like actually calm my nervous system before anything else, and so it's just like this huge I feel like big mindset shift that is hard in our culture, because we don't like just US culture here, like we don't really even I don't know, we don't really value that, or we're like,
Yeah.
I don't know. So I don't know, I like the expression you use, like, is your nervous system ready? Like, to me, it sounds like, hey, can it be challenged and not have the negative effects, where it goes more into like fight or flight?
Yeah. So in behavior analysis, we have this term called progressive ratio. And that's also a sense of like collecting data of like, how far is someone willing to go before they run away, right? Or before they stop, before they don't want to do it anymore. And that helps us kind of gauge like, okay, maybe you're willing to do like a student's willing to do 10 math problems for one piece of candy, but they are not going to do 50 math problems, right?
Yeah,
That's worth it for them, right? And for us to kind of gauge like how much is enough for you or how much is okay. And another thing I like to ask clients, I feel like this is a helpful skill for all of us to practice, is like, if I'm like, all right, I'm going to go clean the house, I'm going to go do this, I have all these errands. But if I ask myself, like, if I rate from a 0 to a 5, or say 1 to 5, so 1 is like easy peasy, I can do it 100%, is nothing, like I don't need to think about it. 5 is like, I will probably never do it, it's like impossible.
Yeah.
If I rate it, if I ask somebody or ask myself, like, okay, where would I rate this task today? If I rate it a 3 or 4 or 5, what I usually tell clients is like, honestly, don't bother. Like, we need to shift your goal or change that goal in some way, because that's almost setting ourselves up for failure.
Okay.
If it's already too hard. If it's like 2, I'm like, eh. But if it's a 1, I'm like, yes, let's try it. Let's do it.
Oh, interesting. Oh gosh, that must be so. Yeah. So tell me about like clients' reactions, because I imagine some people come in and really are like, I want to push myself. Is that the majority, or the majority of people like, my parents sent me here and I don't really want to be here, so the 1 is great, you know?
You know, it's funny because I think the work that I offer is very catered to people who want to learn and who understand that to a degree there needs to be change on their end, like responsibility taken and action on their end. And the reason I say that is most of my clients, to be honest, they're very receptive and open to strategies like these or exercises. And unfortunately, the ones who are not open to it, they usually fall off because they'll either realize, like, 1, I didn't sign up for this, I don't want to do the work. Maybe they're not ready to do the work, and that's okay, right? But most of my clients, I would say, they're open and receptive because they understand this is going to help me, and she's on my side, right? That's another aspect, right, of trauma, is like, if you are stuck in dysregulation, stuck in trauma, it's easy to think like, this person's, trying to make me do X, Y, Z, know, but I'm like, if they can't see me as somebody who's on their team and on their side, that's a whole different barrier that I can't control.
Yeah. I know I kind of jumped around because we went back to the past when I was asking, like, how during the pandemic did you realize that you had your own like anxiety and trauma issues? Sound like there were some issues that you knew were things that needed to be worked on. But right now, what you're talking about with somebody who might have trauma and just kind of has like, I don't know if the right, trust needs to be really earned with that person to be like, yes, you are on my side. Like, I don't need to keep my guard up with you. But a lot of people would be like, well, that's just normal, right? Right. So yeah, can we dive a little into like where my head's going is like your experience where you were like, no, there's some deeper trauma work here. And I'm kind of thinking, for our listeners, because a lot of people don't know that they have trauma work that they could benefit from, right? So how, just as you're talking about it, kind of, I think we could probably kind of call out what are some things that show up with that might be more commonly related to trauma that's not very well known.
I think trauma can show up in so many different ways, but some of the more common symptoms might just be rigidity, right? So needing things a certain way. Maybe you struggle with transitions, or if, like, I don't know, if my child like spilled milk and I'm like trying to rush to work and I get really like freaked out and I'm like, why'd you spill the milk? Like, I get so dysregulated in the moment when unexpected things like that happen, right? So it's just this need for control.
Yeah.
Not either at all times or just honestly just consistently. That could be emotional control, it could be situational control, but there's a sense of control that we need to manipulate to feel like we can operate on a day-to-day basis.
Yeah.
That would be fun. Another one.
Can we touch on that? Because the need for control, like, you talked about with like the milk and the cleanliness and maybe controlling it, like it can show up as like kind of needing to control the people around you, right? And how they behave. I know for me, like I didn't realize how that was feeding in like to control in the workplace. Because it was like it would show up as like trying so hard to prevent a problem from happening. So that was a part of like trauma work is like, okay, I've called it out, what's going to be my limit for calling it out? Like 2 times. Okay, I've called it out to this leader 2 times, letting that be it. Because without having done that work, it was like, there was so much panic to, oh my gosh, I see a problem that's going to happen. It's very likely going to happen. Trying to control, like, it's like watching a train wreck and then trying to like control it. I didn't realize that that was trauma related until, having actually done the work in therapy. And I think like for a lot of people, like, it can show up in their workplace, I think in these wants to control. And I guess where other dynamics where you think there are like common ways it's showing up. Like you kind of mentioned a parenting type thing where like something like an honest spilled milk happens, right? Like we kind of expect that, right? So this like instability that comes when that happens could be like a signal of control.
Right. So I do think it's important to note that I want to bring up the fight, flight, fawn, and freeze. That's like kind of the protective emergency responses that our nervous system go into. And the reason I say that is like we all have a tendency to go into a fight or flight, but what separates trauma or kind of chronic dysregulation or puts you in that category is that if you're operating in that consistently throughout the days and weeks, right? So like if I'm in an emergency, right? Like a bear's coming to lunge at me, like hopefully I'm running or hiding, right? That is a normal response. But what determines if you're stuck in that is like, can I come back down pretty quickly? Can I come back to connecting with someone I care about and to seek out the help I need and to be like, okay, I'm okay. The bear is gone, right? Trauma is like the bear's there 24/7, constantly. It will never go away. You're running, or you're fighting, or you're hiding. Right. And that can come out in a lot of different ways. So hiding, again, we can think of, are we running away and avoiding things that are difficult, right? Whether that's emotions or thoughts. Are we binge watching on TV or eating emotionally or staying busy with tons of tasks? Are we avoiding and running away? Mm-hmm. Right?
Yeah, I know the staying busy one, that's for sure. Yeah.
Oh, yeah, that's a very common one. I've done that so much. Or it could be fighting, right? Like maybe I pick a fight with my husband because I'm upset. I'm like, why did you do that? I told you like 20 times not to do that. Right. So I'm attacking him. I'm fighting him. Yeah. So that could be, a sign. And again, it's more like, how often are you doing this? Yeah. Or there's even freeze where, my husband struggles with this. Like maybe I get emotional, I get upset, and he honestly just shuts down. He doesn't know what to say. So he just turns silent. Yeah. Or he sleeps for a very long time and he struggles with waking up in the mornings. Right? Things like that. Yeah. And then we have fawning. Oh, sorry. Good.
Oh, no, this is good. These are really good points. But okay, because you're going to go into something and go ahead, because I want to dig into how this feeds into like. Yeah,
I was like, I feel like you'll like fawning. Women struggle with that a lot, but fawning is like we people please, right? Our value as a woman comes from producing, comes from creating results, comes from others being happy. We're happy with what we do. Yeah. Right?
So there's, as women, we're kind of trained to be good and helpful and do all that. And then there's fawning, which is the trauma response to like the perceived threat, right? Mm-hmm. And when working with an individual, like how long does it take you to generally like suss out like where they are in this spectrum of that behavior? If it's like, okay, this is like a societal, like, yeah, this is how women are raised, it's, still not healthy, but can take work, versus, okay, this is like a deeply ingrained like trauma response that needs more attuned work. And I'm going somewhere with the question. So yeah, I'm curious, like, is that something that like can be assessed early on, or is that something that as you're working with someone starts to become clearer over the duration of time?
I do think the more I get to know them, right, the more I speak with them, the more I can learn as to where they fall or where they are. But I do think somebody who is more stuck in trauma, you see those multiple layers, right? So
Okay.
it's not just anxiety, it's I can't sleep, I have insomnia,
Yeah.
I doing this, like I'm struggling with this, I have chronic pain, I have headaches. Like the more symptoms, obviously, the more layers and there's just more to address, right?
Yeah.
Versus someone just like I have anxiety, or if someone just has enough level of self-awareness for that, that's always a great start. That tells me they've done some work, right? Like, okay, I know I have anxiety, I know this, but maybe they're stuck in rationalizing, right? And so like, yeah, I know this, but I'm still struggling.
Trying to mute it while my dog was barking. Um, okay, so we were talking about like the common patterns that showed up that we didn't know was trauma, and then with fawning. So okay, so since this is going to be edited, I'll tell you where I'm like trying to go with it, and then we can figure out how to get there. So what I find super fascinating about your work and with behavior is it can be very like there's value in the like relational dynamics, right? Like of what about my behavior might uh, be allowing an unhealthy dynamic to continue. Yeah.
Mm-hmm.
Um, and I think I think what I want to like what I want to get to in our conversation is because we're talking about the use cases that are there outside of autism, and like I'm just thinking about people that are in relationship with like narcissistic personality or narcissistic traits, right? Like things that there's a certain dynamic to it. Um, so that, like, yeah, I'm trying to figure out like like how do we expose that part of the value of this work, within this conversation, so people can understand, like, if somebody's struggling with, I keep finding myself, no matter where I go in a relationship with somebody who is like passive aggressive, you know, what pattern of mine am I unaware of that keeps getting me in this dynamic, or with somebody who like can easily manipulate me, what
Yeah.
pattern, like I guess maybe it's just a question of like how, because there are more general use cases, like what are these like incredibly valuable ways to look at how your behavior might be contributing to something that is really hard for you and that you're also trying to get out of, like in the interpersonal dynamics in that person's life, because usually the patterns are showing up at home, at work, in friend groups, all around.
Yeah. I mean, this is honestly where behavior analysis is extremely powerful, right? Because if we can understand and learn that every behavior is reinforced by something, it is encouraged by something. What that something is dependent on the response, right? So if I can recognize, for example, like if I say something, and like if my husband says something and then I reinforce it, either that means I'm responding to him, I'm praising him, whatever, but then I get annoyed that he does it again. Well, I have to be able to look at that behavioral pattern like, well, am I reinforcing it? Am I maintaining it? Am I encouraging it? And if so, and if I can recognize that, I can then shift my response to change that. And what in ABA, what we call fade it, meaning like, and I do this all the time in my marriage, to be honest. My husband's like, you're ABA me, and he knows it. Maybe I redirect him or I don't respond or reinforce it. And because I don't want to hear that response, right?
Yeah.
And so it almost sounds like manipulation, but it's good manipulation, right? It's a way to manipulate our own responses and even those that we care about to come to a better result, a better outcome.
Yeah, when you're talking about it, because I know it can sound like manipulation too if someone's hearing it, but like I almost think of the phrase like we 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 tell people how it's okay to treat us by our responses, right? So like you're cueing like this is okay to treat me this way or this is not. You're not trying to manipulate them into doing something that they don't want to be doing in their own life, you know? It's like it is like in relation to you and how you want to like I guess be in that relationship, you know, and
Yeah.
and it's a dance, right? Because he can do the same back to you.
Yeah.
Right.
And so like a healthy example would be like I had for several years I was working on advocating for myself, speaking up because I didn't know how to before.
Mm.
So in the past, my husband might tell me something and my response would be, okay. But then later I get resentful, I complain about it. So what I did to shift that was I changed my response, right? So if I'm not okay with something, and this is what we call replacement behavior in behavior analysis,
Okay.
what can I replace it with instead? If I'm not happy with this situation, I'm not happy with how he's talking to me, responding, okay, instead of saying, okay, what can I say instead? I replace that with, hey, I didn't really like that. Can you say this next time instead?
Yeah.
And that creates actually a better connection between us because I'm now speaking up, I'm changing my response.
Yeah. I love this because one of the biggest lessons I know that I had to learn was I guess where this was showing up in ways I didn't anticipate in relationships. Like I had a friend that you know, whenever I just called out something that she'd done that had upset me, you know, like big things, you know, like uh hey, we agreed I was sharing this with you in private, and then you just went and talked about, you know, like it would be like a small little like, remember it was meant to be in private, but the friend would go silent for months. And then what would happen then is when she would reengage, it would be really hard to bring up the topic because, you know, there was a story in my head of like, oh my gosh, but that was months ago. But that was months ago. I can't bring it up now. Like it would be, just be too embarrassing. So that was the cycle that had developed for years, which was, you know, disappear, come back, and then we sync like nothing happened. And you know, it took a while for me to learn, like, oh, because the pattern works for her. You know, like, I mean, my therapist helped me see that because this pattern works. She
Right.
knows that if she disappears for like months and then comes back, I'm not going to bring it up again, you know? And so I had to do what you were talking about. What is it? You said
Replacement behavior.
behavior. Yeah. And then I know when she came back after months, you know, I had to be like, I still like to talk about this thing, even though it's been months, you know, and that really shifted our dynamic, you know, because and I think like I'm calling this out because I don't think like for me, I just had no idea that this was the dance that we always did. And without knowing it, you know, like I kind of would blame myself and be like, gosh, this seems so petty to bring up months later. This seems so small now that it's been this many months, you know, and I haven't talked to this person. I've missed that, you know, like there was a lot of like self-blame that kept me from doing what actually would have been a positive step towards like, you know, my goal with that relationship, which was to have repair, to have understanding, and to just have some trust that like this was understood, and, you know, they would do their best to course correct moving forward, you know, things like that. So I feel like that um, yeah, insight for interpersonal dynamics is huge. And you must have been able to see like big shifts in people's lives as they've been learning to change their own behaviors, you know, to fit the goal that they want with their relationships, I guess. Um,
Yeah. Yeah, I would say honestly, the biggest shift has been in my own personal relationships, right?
yeah,
If we know how to apply those, like, I mean, if you knew the shifts that me and my husband have been through, it's it's those types of shifts where like you think that the only answer is divorce, or the only answer is something that we cannot resolve. And I think, like you said, a lot of times we either fault to just like, okay, I can't, there's no other answer, there's no other solution, and we run away from it, or we blame ourselves.
Yeah.
Go into this tunnel hole of shame. But I think unless we're given those tools and taught those tools, right? And I think that's so much of the work, is like realizing, oh, I could respond a different way. Oh, there's actually tools that can shift this.
Yeah.
Right? Then you realize like it's actually we can make it work. It's doable. Whether that's your own personal journey or within interpersonal relationships.
Yeah, I love that. And I love that you and your husband have been able to apply it and like work on your relationship. I imagine though there's a lot of people who might be in some unhealthy dynamics or like toxic dynamics, and they're trying to shift their behavior, but the behavior isn't shifting from the other side. There's like a big reluctance, you know. And I know just because like on social media where there's so much about toxic relationships now, and I know even the word narcissism is thrown around loosely, but that's, I think, an important one in the context of trauma, you know, because this is, these are like the type of dynamics that can be very like manipulative and subtle. And you have to be able to understand. I mean, really the only people that I've met that, you know this work are people who have done like trauma informed work. So, do you think that, or have you seen that a lot of people probably have, blind spots to where they are in unhealthy relationships in their day-to-day life, and are unaware of how much that's impacting them?
Yes, right. Certainly. I do believe that. And honestly, sometimes I feel like our biggest barrier is actually ourselves, right? But again, we have to come to a safe enough place where we feel okay and safe enough to be honest and to accept our circumstances. And if we don't feel safe enough to do that, we're going to be stuck in denying and stuck in like, well, it's his fault. Well, he's doing this, she's doing this, right? That's what we call that dysregulated state of blaming almost anything and anyone except for ourselves. Well, actually, we are blaming ourselves, but it's not about blame. And that's where trauma shows up. Trauma is all about we blame. If we're not in trauma, we're like, hey, we engage in more curiosity and creative problem solving. I'm like, I wonder what's going on here. I wonder if I can ask.
Can you say more about that? Trauma is all about blame, because this is a pattern in families and organizations, right? Can you talk about
I mean,
the blame dynamic?
it comes down to having a sense of control, right? We need to control something or someone. And it's easier to put up that guard and that shield and be like, it's their fault. Because to be able to say I played a part, or to be able to say that I have to look at myself, for some people that's too painful. That's genuinely too painful. Or it could just be something that they've been reinforced to, like a habit of thinking, right? Either way, it's usually stems from like, this is too painful, so I'm going to avoid and deflect by putting it on something or someone else.
Yeah. So you had mentioned earlier how you had to go through your own journey and like learn to advocate for yourself and speak up for yourself. And now doing all of this like nervous system work, like what did that feel like before for you when you had to like speak up for yourself, and what does it feel like now?
It was so scary. I mean, and I say this to my clients too. I'm like, when you're starting a new skill, and honestly, everything's a skill, it feels uncomfortable. You feel guilty. You feel shameful. It feels so weird. It feels foreign. You feel like you're doing something wrong.
Yeah.
right? Because you're not used to it. A lot of times people who are stuck in trauma, we're used to unhealthy responses. That's what's helped keep us safe. So that is what we're accustomed to. And when you break down those walls, you're like, nope, nope, nope. You're like, oh my gosh, what is wrong? Like, what is going on? And that in itself is kind of something you have to explore. Is like, okay, now I'm at a choice point. Do I want to keep making the same choice and engaging in the same responses that, yes, felt safe, but were hurting my relationships and hurting myself? Or do I want to engage in this new response that, yes, it's scary, but it's going to make me feel more fulfilled, experience more joy in my relationships? We have that choice, but we have to understand that we have the agency to make that choice.
Yeah. And like you
But
said,
yes,
it's a skill.
scary.
It takes time and practice, right?
Yeah, yeah, it
Um,
takes so much time. I think in behavior analysis, this might be an older study, but I think you have to do practice at least for 2 weeks minimum to see any real consistency or results. Like really be consistent with it and then see where you may need to pivot.
okay, that makes sense. And that seems like a realistic time frame, like 2 weeks. Um, and what I love about that and where you come back to is like knowing yourself and then still feeling safe within yourself. So if the other person doesn't respond the way that you want them to, I know you said at the beginning, like also being able to be honest with yourself. And that's hard work. Like, you know, that's hard. Like I just think about like the stereotypical things on movies where, somebody's talking to her girlfriends about this guy that she's dating and everyone's like, why can't you see he's blah, 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 and she can't see it. I know I've been in those situations in my own life in so many different capacities where I just could not see the person in front of me separately from the person who I wanted them to be.
Yeah.
Um,
I think it's a mind shift, right? Like you were mentioning this because again, it's comfortable to think that way. It's comfortable to be like, I don't know what's going on. Why doesn't he just change, right?
yeah,
But I think a question I always remind myself is, what is the cost if I don't change? Or what
yeah,
is the cost if I don't look inside myself?
yeah.
What's the
So
consequences?
as you're working with individuals, like they are building their bravery, like with each attempt that they're trying out a new behavior of their own, right? Or even just understanding their behavior and watching how that's impacting them in their day to day. It just seems so beautiful and profound, and an amazing opportunity to get out of these like stuck cycles and feeling like, well, that's just life, that's just life and the way it has to be.
Yeah, I mean, it's hard to describe when you come to that realization of relief that it's not on you,
Yeah.
right? Like, oh, it wasn't me or it's not me. Oh, I have people who genuinely care and can help me and guide me and teach me these skills. That's crucially important, right? At least in my work and my services, that's why it's therapeutic coaching is like, I don't want to just tell you what to do or tell you these skills. I want to practice them with you. I want to role play. I want to set you up for success so that when those situations come up, you feel confident, you know what to do, right?
Yeah.
And that's really important to break from that trauma is having that sense of confidence and agency.
Oh, it's beautiful. And can you talk more about your services? And I'm especially curious, like how breath work then feeds in. Um, yeah,
Yeah,
how it feeds into all of it.
I think it's different for each person. We have to keep in mind, and maybe not everyone knows this, but breath work is not for everyone, right?
Okay.
Especially if maybe you've had a previously bad experience with breathing. Maybe you've struggled with panic attacks and breathing and hyperventilating is really scary for you.
Mhm.
Maybe it could honestly be anything. And so that's the first thing I gauge is one, I again, goes back to agency and autonomy. Like, hey, are you open, or are you comfortable with practicing this breath exercise? If they say no, okay, then we're not going to do it. And
Yeah.
so that is 100% an option. But I also have clients who want to do a lot of it, or they found like, I worked with one person where like she couldn't sleep for weeks, and me doing this breath meditation was actually the first time she was able to fall asleep during our session, actually.
Oh my gosh, that's amazing.
Right. And so for some people, it's really impactful. But I think to a degree, you have to be in touch with your body to be able to access that, right? So everyone's at different levels. I only will offer it and teach it. And again, breath work can help with anxiety. It can help with chronic symptoms, headaches, both mental and physical symptoms. But the person needs to be open to it.
Okay. Yeah, and it sounds like you can guide them to see like if they're open, if they're comfortable, and if they're not, it's no pressure. It's not a requirement.
Yeah.
And yeah, I'm curious because we have like about 10 more minutes. Yeah, I'd love if you could just tell us more about your business, your services. I know you have so much amazing content on social media, so we'll put that in the show notes. But yeah, like if people are curious about this now and their behavior and how it might be something worth looking at to, move their life in the direction that they're looking to go. Like, tell me a bit more about your services, and do you work remotely, in person, all of that kind of stuff?
Yeah, so the company I run is called Behavior Roots. And my website is literally just behaviorroots.com with 2 R's. And I offer therapeutic coaching. I call it therapeutic coaching. It's essentially coaching, but again, with that trauma-informed approach, it offers that therapeutic safe space for them. And I also offer training, workshops to groups, honestly, anything that can teach people those life skills, whether that's mentally or emotionally or physically. And so my goal is to help equip you to understand what is going on inside of you. Maybe you suspect neurodivergence, maybe you suspect trauma and you're not sure. I help you with that. I have tons of assessments, right? And then I teach you things, tools, exercises to help move you forward. My goal is to hopefully not have you get stuck with me, right? My goal is to teach you enough where you're like, I think I'm good. Like I handled that fight with this person the other day so well. And I'm like, this is amazing. Like, this is what I want. Is I want you to have those skills yourself. You learn these skills on your own. And I think the big thing for me is I think therapy and everything is great, but the best form is to be self-sufficient in those tools, right? So I want you to be able to not have to wait a whole week before you see a therapist and you've been holding in all this stress because this fight happened like a week ago. I want you to know how to respond and what to do in that moment.
Yeah.
So that's kind of part of my services, is just teaching, supporting you, guiding you, offering even that mental health space and support if you need that.
And you do workshops as well, right?
Yeah, I've done a couple workshops for both parents, and that's like parents with, children with autism, or it could be teachers, staff, school admin. I've done a couples workshop as well on just communication and resolving conflict. I love doing those.
Yeah.
And I would love to honestly do more workshops if anyone wants to host me. So.
Oh, very cool. Okay. That's good to know. That's really good to know. Gosh, Annie, this has been just so much fun. I know that we could probably dive deeper into, like, you have so many resources available. So I want to make sure, like, we'll definitely include your website and your Instagram, but you just have so many resources available. Like, it's amazing. Like, I've had so many little aha moments as I've been going through, your social media posts, where I'm like, oh yeah, or validating moments. It's been really, I think your page is a very like healing and not inform, like an informative resource that can also be very like healing and validating for, for many people. So I'm just so excited to continue watching your work, and probably we'll have you back on here and maybe we'll deep dive into one of the many topics we didn't get into.
Yeah, thank you. I appreciate it.
Of course. So I'm going to just hit stop on the recording and then we can chat for a little bit.